the leader of the third party knows that what people see in our budget, Mr. Speaker, many of them across the board, they see $2.5 billion in a Jobs and Prosperity Fund, Mr. Speaker. They see $130 billion in public infrastructure investments, $11.4 billion in hospital expansions, a Made in Ontario retirement pension plan, an increase in the Ontario Child Benefit, an increase in social assistance benefits, and $810 million for people with developmental disabilities. That's all part of our plan.
Thank you. New question? The member from Leeds Grenville.
Thank you very much, Speaker. Good morning. My question through you is to the Minister of Community Safety and Correctional Services. Minister, it's been 7 years since Ashley Smith suffered her terrible death, and 7 months since a coroner's jury made recommendations so that this type of tragedy wouldn't be repeated. On May 1st, the federal government partnered with the Royal Ottawa Healthcare Group to fund a 2-bed pilot project for mentally ill female offenders at the Brockville Secure Treatment Unit in my riding. The partnership between the federal government and the hospital is because of this treatment model's outstanding results with mentally ill male offenders. Minister, you know there are far too many women like Ashley in our Ontario jails suffering. My question is, do you think we should deny them access to a program male offenders have been able to access since 2003 because of their gender?
Thank you.
Thank you very much, Speaker, and I thank the member opposite for asking a very important question. I know it's an issue that the member has spoken about in the past and has advocated, and I know my predecessor, the Attorney General, has worked with the member opposite on this issue as well. And Speaker, so do I. I continue to look into this matter. I've had the opportunity to speak with the CEO of the Royal Ottawa Hospital, which happens to be located in my community of Ottawa Centre. And most recently, I had a brief conversation with member opposite, and I look forward to continue working with him on this very important issue so that we are providing appropriate mental health treatment for all inmates within our detention system. Thank you, Speaker.
Supplementary.
Yes, you're right, Minister. I have spoken to you and your predecessor about this. In May, a spokesperson told Global News your ministry, quote, would be willing to review any proposal put forward by the federal government. Well, your government has given me the same answer since 2010, and the federal government has stepped up, Minister. You're wrong. The Attorney General is wrong.
Chair, please.
It's time to drop the excuse that you can do nothing now that the feds are moving forward. The good news is you've got a great opportunity now to do the right thing. You know, Minister, the good work that the Royal Ottawa Healthcare Group does with mentally ill patients. You know the good work that they do. So I'm asking you, will you commit today to bring the province to the table and finally move forward with a plan to treat mentally ill women offenders? They shouldn't be in the jail. They should be getting treatment. Minister, when will you come to the table?
Thank you. Be seated, please. Be seated, please. Thank you. Minister.
Thank you very much, Speaker. Again, I thank the member opposite for his question, and I will restate that this is a very important issue. We need to make sure, Speaker, that we are treating all our inmates with fairness, with respect, and they deserve the same access to support as those in the community. And I will continue, as the Minister of Community Safety and Correctional Services, I will continue to work along with all members of this House to ensure that those type of services are presented for inmates in our custody. Speaker, Ontario has now in 10 correctional facilities with mental health nurses on site providing specialized services to inmates, and we are launching the Forensic Early Intervention Service at the Toronto South Detention Centre. It's the first strategy of its kind in Canada. There's a lot of work that is ongoing right now, Speaker, in our correctional facilities to ensure that inmates with mental health challenges are given proper treatment. I look forward to working with the member opposite to make sure that female inmates have fair and equal treatment available to them as well. Thank you, Speaker.
New question. The member from Bramalea, Moulton.
Thank you very much. My question is to the Minister of Finance. Mr. Speaker, 4 years ago, the Liberal government put $2 billion into the pockets of the insurance